Tonight, the story of a young Iowa girl who is being given the chance to delay the onset of type 1 diabetes through a special treatment at Sanford Health.
Yeah, this is not a cure, but it is a meaningful step forward in treating this disease.
And the experience, I just wish that everybody could have the same experience that we've had.
Sometimes a mom's intuition ends up being 100% right.
I had asked them to work her up for type 1 diabetes, strong family history of it, I have positive antibodies.
This past January, Aubrey Mulgard's daughter Elin got sick, and on a bit of a whim, Aubrey asked her doctor to run some tests on Elin to see if she might show any early indications of type 1 diabetes. And those tests showed Elin had what are called markers, medical indications that the onset of type 1 diabetes was possible. Not too long after those results came in, Aubrey and Elin met Dr. Kurt Griffin with Sanford Health in Sioux Falls.
These are really exciting times for type 1 diabetes. It's really the first time that we're beginning to have some traction on the underlying process.
Dr. Griffin has worked on clinical trials of drugs that aim to slow and eventually stop type 1 diabetes. One of them is called Tzield. For years, diabetes has been managed and improvement measured in how blood sugars can be monitored and how insulin can be more effectively delivered. Tzield is different in the best possible way.
If this drug can delay that by a median of 2.5 years, and some of the kids go out to 6, 7, 8 years, you see that's not where we want to be really in terms of stopping it completely, but in terms of really stretching out when somebody might need insulin, that's a huge impact clinically.
Tzield can delay when type 1 diabetes takes hold in someone's body. It cannot stop it from happening, but it can help someone maintain a normal life longer.
You would give it every day for 14 days in a row.
Delivering Tzield is done through an IV, and it is a 2-week commitment.
Everything lined up appropriately.
And it's more than worth it for families like Elin's.
We stuck her on a continuous glucose monitor and we were able to see her post-meal spikes and then hypoglycemia.
But here's the thing, Tzield does not work on those who already have full-blown type 1 diabetes, only in those who are likely to get it but haven't yet. And that leads to the question that Dr. Griffin and everyone else is left asking.
How do we find the kids who are on this path to type 1 diabetes who might benefit from this?
Well, the answer to that is families have to be proactive. If there is a history of type 1 diabetes in your family, test your kids when they are young sooner rather than later. If those type 1 markers show up, they can take Tzield. But there are type 1 patients who develop the disease without a family history, and for those folks, it is a little tougher to know.